COVID-19 cases and hospitalizations are on the rise again in the United States, coinciding with children returning to school and the approach of colder months. But here's where it gets controversial. While these numbers are increasing, they remain significantly lower than what we saw during the same period last year. According to the Centers for Disease Control and Prevention (CDC) for the week ending August 9th, the COVID hospitalization rate reached 1.7 per 100,000 people. This is twice as high as it was 2 months earlier. At the same time, the percentage of positive COVID tests climbed to 11.2% for the week ending August 23rd, a sharp increase from just 3.3% in the previous 2 months. Despite these upward trends, it's important to put the data into perspective. Hospitalization rates are still roughly 3 times lower than they were at this point last year, and the share of positive tests is about half of what it was during the same time frame in 2023. This suggests that while the virus is circulating more, its impact on severe illness and hospital strain is less intense than before. Tragically, COVID continues to claim lives, with about 200 Americans dying each week over the past 2 months, according to CDC figures. This ongoing toll reminds us that the virus remains a serious health threat, especially for vulnerable populations. There's been some confusion about who is eligible for the newly authorized COVID vaccines. The Food and Drug Administration, FDA, recently approved updated vaccine versions specifically for people over 65 and younger individuals at high risk for severe disease. However, federal health officials emphasize that anyone who wants the vaccine can get it, regardless of age or risk status. The CDC's data also reveals that test positivity rates have surpassed 10% in many parts of the Southwest and Western U.S., coinciding with the start of the school year. This rise in cases is partly due to increased social interactions and indoor gatherings as the weather cools. Dr. Peter Chin Hong, an infectious disease expert at the University of California, San Francisco, told ABC News, "When all is said and done, I expect this season won't be as severe as last year, but that doesn't mean people won't get sick." He pointed out that although fewer people are being hospitalized proportionally, hospital admissions are still occurring. He attributes the increase in cases to the fact that many people had COVID more than 6 months ago, combined with the emergence of new variants. As of the week ending August 30th, the dominant COVID variant in the U.S. is XFG, a subvariant of Omicron, responsible for about 78% of new cases. Other Omicron offshoots, NB.1.8.1 and LP.8.1, account for 14% and 3% of cases respectively, according to CDC data. Dr. William Schaffner, a professor of preventive medicine at Vanderbilt University, explained that these variants are all closely related cousins within the Omicron family. Importantly, none of these variants have developed major mutations that make the virus more contagious or dangerous than before. Instead, they tend to cause milder illness, meaning fewer hospitalizations. These cousins share traits. They're quite contagious and can cause a lot of mild disease. Schaffner said, "By mild, I mean symptoms that usually don't require hospitalization." Looking ahead, Schaffner is optimistic about the vaccines coming this fall. Pfizer-BioNTech announced that their 2025 to 2026 COVID vaccine will specifically target the LP.8.1 sublineage, aligning with FDA guidance to better match the strains currently circulating. However, the rollout of these vaccines remains somewhat unclear. CVS recently stated that how they offer the shots will differ by state due to varying regulatory rules. Currently, 34 states allow people to get the COVID vaccine at CVS pharmacies without a prescription. In 13 states plus Washington, D.C., a prescription is required depending on age. Meanwhile, in Massachusetts, Nevada, and New Mexico, the vaccine is not being offered at CVS at all. Dr. Chin Hong expressed concern about declining vaccination rates as the U.S. heads into the fall and winter respiratory virus season. He warned that both waning public interest and federal government policies creating barriers could lead to fewer people getting vaccinated, even those who want to. This could result in preventable hospitalizations and deaths, he said. If vaccine access were simpler and more straightforward, we might avoid some of these outcomes. Dr. Schaffner advises that anyone eligible should get the COVID vaccine along with the annual flu shot. He also recommends that people with risk factors for severe illness take extra precautions. Don't hesitate to wear a mask indoors in crowded places, he suggested. And if you're worried, consider social distancing, like streaming a movie at home instead of going to the theater. This ongoing situation raises important questions. Are we doing enough to encourage vaccination? Should vaccine eligibility and access be simplified nationwide? And how do we balance public health measures with personal freedoms? We'd love to hear your thoughts. Do you agree with the current approach, or do you think changes are needed? Share your opinions in the comments below. ABC News reporters Yuri Benedoud and Cheyenne Hazlitt contributed to this report.